he's disappeared. And he's a guy who said that he went to save the daughter from the hands of the husband the other day, and said that the big families suffer gender-based violence, but they're hiding it under the carpet. And this is a menace to many people in the society, and the numbers do not look good at all. You're the lady of numbers. How do those numbers look?
So yes, thank you. So allow me to say that gender-based violence cuts across economic, economic level. So it's not just about the rich, it cuts across ages, cuts across everything else, and can have all diversities. So it's not, so we're all vulnerable, so to speak. And when you go to the numbers, according to the Gender Violence Coverage Center, our annual year starts from April to March. So I'll talk about April 2024 to March 2025. We had a total of 3,455 cases. I must mention that's quotes and quotes the norm, and we'll talk about normalization later. That means when there's no violence, there's no pandemic, shadow pandemic like COVID-19, when it's, the country is stable. So of course, the next year being an electoral period, we expect the numbers to go up. Again, let me speak to that also. We had, out of that number, we had 113 teenage pregnancies. We had about 35 persons with disabilities. 90% of them were women. And of course, the rest were male. And we also had a big percentage, being about 76%, being sexual violence, because then there are also different forms of gender-based violence, being sexual violence, physical violence. There's harmful cultural practices. We have psychological violence, emotional violence, and economic violence. Now, this year means from April to October 2025, the center had 1,687 cases of gender-based violence. So, yes, the number, yes, it's high. And among those, then there are also femicide cases. Just a few months back, we lost a lady who was about 50-something years. She was raped, and when she was plucking tea in Kiambu, and then she managed to go to Kiambu Hospital, got medical treatment, was referred to us, got surgery, but apparently we lost her. So also to mention that these are the survivors. We also have femicide cases, and that has also become an upsurge in Kenya. Just the first 3 months, we had about 129 cases. So again, gender-based violence has a lot of it that's underreported, that's not reported. So this is not a true reflection, because a lot of times there's masking of the same, or we don't come out because we don't know where to go, or we don't even know that it's violence. So that's also important to note. And again, we also have other forms like technologically facilitated gender-based violence that has also come into play, that where a lot of people don't even know and also report about the same.
So you touched about something of silence.
Yes.
Yeah. How do we get people coming out? Because silence is the biggest. There's a police officer who wrote somewhere, and I saw a lady saying that gender-based violence happens even in the police lines, and they can't even report. When they report, they're told that's a family matter. And she really explained how she contemplated shooting the husband, because I had suspected both of them were officers or something. But they're saying that the silence which is accompanied by this scourge is so big that women don't know where to go most of the time.
So the silence to gender-based violence has many reasons why that happens. So one is because of how we are socialized, or it's culturally entrenched. So we don't even realize that we're being violated, or we are violating. So for example, child abuse, female genital mutilation. And sometimes if you don't conform, for example, to female genital mutilation, you're treated as an outcast. So a certain community, the men will not marry you and things like that. So sometimes we do it because that's how we are socialized. That's the best that we know. Two, silence can also happen when you don't have responsive mechanisms. So for example, I don't know where to report to, or if I report, it's not friendly. I'll either be re-traumatized, or there'll be victim blaming, or I will not get the help that I need. Yes, for different reasons. Sometimes also there's a lot of bystander attitude. At that particular point when one is being violated, so for example, at that particular point when I'm being violated, trust me, everything will evaporate. Where do I need to get help? Or I'm really at the point when I cannot even reach out for that help. So the people around me need to stand strong and actually direct me to that right, for example, help. So a lot of times we assume, we normalize violence. You know exactly what you said. Hiyo ni mambo ya kinyumbani, things that you just deal with them at home. Just yesterday, I have a long-term a schoolmate from high school, and her friends called me and they told me how she's been beaten, and she actually needs metal, to be fixed at some points of her body, and asked some questions. She's stable where she is and all that, in a hospital and everything else, and I'm asking, have you reported to the police? And the answer I got, it's not the first time, we're waiting for the family. So again, exactly, as we speak, she's waiting for, hizo chuma ziekwe. And things like, so that's that bystander attitude kind of thing. And those are some of the challenges that make the silence go on. We normalize it. We think, and again, even the survivors sometimes don't report because of other things like dependency. So if I report, for example, it's my husband who's abused me, if I report him, I economically depend on him. That's where I live. I don't have anywhere to go. My children, for example, their fees to be paid and everything else. So there are a number of things that mask or makes the silence louder. But that's not an excuse. We need to call it out, and we need to seek justice for the same.
And when you talked about also the different forms of violence, and you said that this femicide is on the rise and technological abuse.
Yes.
Why so?
Why so? If you'd ask me, there's also a gap in Kenya in terms of research and trying to understand the why and the evidence generation for programming out of it. So, for example, for femicide, if you ask me, we've normalized that gender-based violence, that now it's gone to the extreme. Two, impunity in regards to the same. And earlier I was just talking to someone and I was asking, okay, out of all this, I think African Census did about counted about 526 cases from the previous year going back a couple of years. And I was asking one of your colleagues earlier, like, how many of those cases have seen through to conviction of the same. So you can get away with it, so to speak. Back to the silence, where we know a lot of these things are happening within our families. 68% of the alleged perpetrators are known to the survivors, according to the statistics at GVRC. And another percentage known and not mentioned. So a very small percentage is not known. And even when you look at the analysis of femicide, the people who've killed, the women and girls, they're people known to them. It's a husband. So how do we hold people accountable? Two, how do we have like a predictive model? How are we able to tell before someone is beaten and killed? What are these steps? What are these telltale signs? And what was that support that we provided to these survivors, so that then it doesn't reach femicide cases. So for me, those are some of the reasons for femicide cases, that we do not call people out, we do not get people accountable for their actions. We just need one, and liwe funzo, and not speak around it, but have conversations around it. And the president earlier this year, around Jan, actually chose appointed a task force to go around the country, get public participation, and also input from organizations to have recommendations on how to end GBV, including femicide. So hopefully, as we start the 16 days of activism against gender-based violence, we'll be able to have that discussion. When you go to technologically facilitated gender-based violence, and you asked about that, so there's an increase in how we access, for example, to technology. And with that modernization, then people have gotten into that space. So yes, it was there before, but it's now higher. You have even I don't have the statistics here, but the people who, for example, have access to smartphones and such things. So when you do not have regulations, for example, around how then are you using that digital space. So kids have met, there's a quarter at GVRC where 4 teenage girls actually met their perpetrators through social pages. Yes, so it's happening. I've met means survivors who come to GVRC, who, for example, children who've been introduced, you said we be respectful but truthful and blunt, children who've been exposed to pornography and gotten abused. I've met a group of boys who used to go to, they're called video dance, and they'll be shown pornography and sodomized. It's called rape, and not once or twice. So that's the risk, for example, and that's what we are facing. We have women aspirants who, for example, would vie, and you have all this doxing and cyberbullying and everything going on. So people have then misused technology, yet it can also be a very powerful tool to create awareness around gender-based violence, and also then, would I say, access to services. For example, GVRC is about to launch an app around how then are you able to access services. So as much as we also condemn the technology, there are also good ways that it can prevent gender-based violence.
Interesting. Solo?
In cases where, let's say, a victim has already stepped up forward and they've given testimonies only for them to be discredited later, how do you handle such situations? Where you're saying, like, for example, if it's a family and it's like they want to settle the matter amongst themselves, what steps do you make to make sure you put it under control?
So one thing that we do is so before even access to justice, it's about keeping the evidence tight, so to speak. So would encourage, for example, if you're violated, do not shower. So there are those steps that you do not shower, get to a health facility within 72 hours, come with the clothes and all that. And then once at the facilities, and we also support you to come to the facility on time. So for example, we do rescues. We have a toll-free number that you can call. You can reach out to a police station, and they're able to bring you to GVRC, to any of the 8 GVRC centers. Actually, 2/3 of our referral source to GVRC the last 3 years is from the police. So once you're then at the facility, the other way to ensure then that the access to justice is there is that then we have trained clinicians and psychologists who then have to have the right documentation. Above it all, you have to get the right treatment, comprehensive quality medical treatment, psychosocial support, which spans for about 1 year. And then once that documentation is done, and if it's rape, for example, we have a form we call post-rape care form. So all that documentation is done. And then we also then have legal aid support. So we have counseling for you and your significant other or your support system. And then we also have legal aid clinics. So we bring on board lawyers who are able to take you through, because then there's also, what should I say? It's court is not also so friendly or comfortable for most of us. So then they'll take you through the process and provide you with that legal aid support. With the judicial side, the police, the judiciary, then we also have sensitization and trainings for them to understand. We're also part of what we call Court Users Committee, so which brings on board all users around gender-based violence. So for example, you have the clinician, you have the police, you have the prosecutor, and in some counties like Kwale County, they actually have like a case management conferencing before the case happens. So then they're able to support you to make the case watertight. And then when you go to the laws, the courts, for example, there are about 14 special GBV courts, so specialized gender-based violence courts, that then you have sensitized staff, because you can also be re-traumatized. And those are some of the reasons why survivors would pull out of a court process system. So once there, so in case all that, so this all is also to enhance the convictions, so to speak. In case what happens and you're not able to, then of course there's appeal. Then we work also with other organizations to be able to push for the same.
But how do you look at the span that the violence has, or the abuse has taken or has been reported? For example, if it happened once and probably it was a bit devastating, it was there was harm, and then the victim and the perpetrator want to reconcile.
Yeah.
And the matter is already up to the authorities. How do you handle that matter? Like they want to reconcile and go back home. How
so
do you
that
ensure?
happens. That happens in one of our branch. I remember in Rongai, one day we had a meeting with the OCPD and the OCSs, and they were saying, yes, we get survivors referred from you, but now we are left here with the cases, and they've reconciled and they've gone home, and they have to account for it.
Yes.
But you see, for us and all of us, I believe, is to have the family unit together. To say, what can I say? If it's a child, of course, the state gets involved. We're also mandated to go and rescue, and we've done that also for children who are abused, and step up, and the agenda officers and children officers and the police from all these areas, and the Nyumbakumis and chiefs and everyone else who then is going to come into play, make sure that you're in a safe situation, get the treatment, and either reintegrated back into society. So there's a whole process of social assessments and reintegration back to your family. So you don't just go back. There are steps, for example. There are steps about, is it family therapy or is it couple therapy that you need? Are the kids safe? Because a lot of time as couples we fight and forget the children. So there are many steps that are to be done. What I do not want us to think is, at what point is that measure of that of violence? I don't know if I'm making sense. Kama ni slap, I can go back. Kama ni, I don't want us to put that measure because it could be the first time and I'm killed. Or it could be the fourth, fifth time.
And you're still killed.
And I'm still killed, I mean, and even if you're not killed.
It doesn't necessarily have to take like a long period of time.
And then that is physical. I want us to also remember that there's also psychological and emotional abuse that's actually worse than the physical abuse. In fact, most of the survivors we get who have physical, whether sexual violence or whatever, there's also a lot of psychological trauma, and the psychological trauma takes longer to heal than the physical trauma.
Which also means that when you're looking at the statistics, a lot of these cases that fall under emotional or financial could also be going unreported.
A lot of them, because we don't consider them as violence. So even at GVRC, the kind of cases we'll get will be really severe cases. You get amekatwa mkono, amekatwa miguu, things like that. Those are the kind, unfortunately, that's where we are as a society.
So when you look at the forms of violence, and you've mentioned them, the areas of prevalence, where are they prevalent? Cities, urban, rural, the distribution.
So I'll make reference to the Kenya Demographic Health Survey. So for example, let me start first with GVRC. So as much as GVRC has 8 centers across 5 counties, you'd find that even the Nairobi units, which is Hurlingham and Adams, who get referrals from Mandera, Busia, they would come for specialized care. Now, when we go to prevalence, and you go, for example, let's use the KDHIS, the Kenya Demographic Health Survey. If you look at, for example, female genital mutilation, in the areas where you'd expect it to have a very high prevalence, it will not be reported because it's culturally accepted. I won't mention the county, but there's one county that there's a lot of female genital mutilation going on, and you'll have conversations with the clinicians and they tell you it's there as late as last month, and there are very many of them. But when it comes to the hospital, because culturally you want to be correct, culturally, yes, we have to be correct, but bad culture is bad culture. You'd find that they're writing the manifestations of female genital mutilation. So, for example, bleeding or something, but they're not writing that it was FGM. I don't know if I'm making sense.
Yeah, making sense.
So, for example, so if you ask me where the prevalence is, it's there. It's just that where it's culturally entrenched, it's going to be hidden. So, for example, child marriages, when you go to Homa Bay, hardly will anyone report about Jaboya, sex for fish, because then it's the norm. If you go to, another area, no one will report about something. Yes. Yeah.
So you are saying that the prevalence is across the country, in short?
Yes. It's just that it shows up in different forms. And we keep quiet about it, so it cuts across. But yes, I totally go back to, we need a lot of studies also done. So
before we go for a break, Alberta, so how do we, because the numbers are scary, let's say 3,500 last year
cases. Yes, 3,453.
Around 500. I rounded it off.
Yes.
So that number is very high. Do you think with the advancement, there's a chance for us to have those numbers come down with awareness, telling people to stop this kind of forms and different forms of violence.
Yes. So as we create the awareness, again in programming, what you've seen, for example, if we have school programs in over 207 schools, you go and create awareness, then you have, or in communities, you have more people reporting because now they understand, now they trust the response mechanism. So all of them have to go hand in hand. Creating the awareness, the sensitization, the prevention starts with also acknowledging that it's there. And it's there in all our spaces, including our workspaces and everywhere else, you know. So acknowledging that it's there. Having, for example, and if it happens, what happens? We don't discriminate. We don't, we don't have the bystander attitude. We don't have tolerance to gender-based violence. We call it out. We support the survivors. And then also ensuring that the laws and policies are in place. And we are seeing it to the end and making it easier for the survivors. So that way then we reduce the impunity and we know then it's wrong and it's wrong. So yes, it's possible to end gender-based violence. How soon? I can't figure it out. That's the question.
How soon, Alberta? How soon?
I wish it was today.
Okay. I think we go for a short break. When you come back, we'll continue with our conversation on gender-based violence, but the numbers do not look good. Our listeners are